Urgent care is one of those fields in medicine that is pretty compelling. You get procedures, you get a very flexible schedule, you get paid well. But is urgent care something that you could handle, something that you would like? How difficult is it? What are you actually doing in urgent care? What are the patients like that you're seeing? These are all questions that I've had and that other people I know have about urgent care. So today I'm going to talk to a PA who has worked in urgent care for over 20 years, and he's going to give us his thoughts on the specialty. So if that sounds interesting to you, then please stay tuned. Hi, it's Michelle with the Medicine Couch. Thank you so much for joining me today. Thank you for supporting my channel. Every subscription, every like of the video, every share of my videos really helps the channel to grow and helps me to continue to bring you videos like this. Now let's hear from this PA about working in urgent care.
Hi, my name is Brad Laymon. I'm a physician assistant, and I've been practicing in urgent care for about 25 years now.
Tell us a little bit about your career path from graduation. Like, did you know you wanted to work in urgent care? Did you go into urgent care right away, or was that something that you transitioned to after you did something else?
I was working as a paramedic actually in Ohio, and I loved being a paramedic because it was exciting, it was different. When I came out of PA school, I started working with an urgent care occupational medicine clinic, and I liked the fast pace of urgent care, and I liked the different amount of patients that you see with different complaints.
So yeah, urgent care is really interesting, I think, because there are so many different things that you're seeing. Like you said, anything can walk in the door, and so it keeps it kind of fresh and exciting, and you can do procedures, but it's also a lot for a new grad. Did you feel that as a new grad, or do you think having that paramedic background really set you up so it wasn't as much of a struggle when you started right in urgent care?
Yeah, it definitely helped quite a bit. I was a paramedic in an inner city for about 12 years.
Oh.
So you see the patients who are really sick and need intervention right away. And it just helps you, in urgent care, because when you see a patient walk in the door, you'll know if they're really sick or not. And you'll know how fast you need to get them back and get some procedures going or an EKG going and try and get them stabilized if they need to go to the emergency department. It definitely helps.
Through the years, I'm sure you've worked with new grads that came into urgent care, but that maybe didn't have that background. What did you think of those people? Did it seem like it was really difficult?
If they were a paramedic or if they were a registered nurse, they'll do very well in urgent care. If you don't have that type of medical background, it's horrifying. It's horrifying for a new grad. And it also depends on your healthcare systems, how much time you're going to spend with them and onboard them. Some urgent care systems have like a new grad boot camp, and they'll take new grads and they'll do some didactic training, and then they'll work in the urgent cares with specific providers for anywhere from 3 to 6 months. And that definitely helps them out.
So what about like somebody who's not necessarily a new grad, but that's coming from maybe another specialty or even family practice?
We still spend time with, like, if somebody came from family practice to urgent care, it's definitely going to be a learning curve because we're doing more procedures. And it's just like if I wanted to go into family practice, I'm sure I'd be lost for a couple months also. So it is a change.
Okay, so let's talk about the patients that you see in urgent care. Do you have any age limits in your urgent care?
I know some urgent cares, I think they cut it off at 6 months, but yeah, some of our patients will bring in a newborn, and you quickly assess and get them to the right place. Certain locations, you may see more elderly patients. Other locations, patients generally in the 30s, 40s, 50s. But yeah, we see all age patients.
I think the big scary thing to me or other people may think about urgent care is how many patients you're seeing in a day. Why don't you tell me, in your experience, what you think is kind of an average number of patients seen in urgent care? And I know it can vary by season.
35, about 3 patients an hour is probably about average for us. Now, if they all came in 3 patients an hour, it would be great. But you may not see somebody for an hour and a half, and then 10 minutes later, 8 people are in your waiting rooms. Centers that may be getting into the 40s, close to 50, we like to send another provider over there for maybe half the shift and kind of give them a break so they don't get burned out. That's a big thing in urgent care is burnout, especially during flu season, during COVID. It gets really intense in urgent cares during flu season, and it's a lot of work. Now, some urgent cares do have scribes, so they have a scribe that'll go in with them. And if that's the case, if they're just talking the history and the exam out loud, and their scribe is documenting everything, yeah, I mean, maybe you could get to 50 or 60. Would I want to do it? Absolutely not. It's dangerous to me if you're getting close to 50 or definitely 60 patients. I don't see how you can do it. I wouldn't be able to sleep at night. Okay, did I put that referral in for that patient? Was that patient allergic to penicillin? Did I prescribe them Augmentin? I mean, I would just go crazy.
Yeah.
That's just a lot of patients in 12 hours.
I'm very cynical about medicine nowadays, and with private equity firms and people coming in thinking they're going to make quick money in medicine and are starting to demand these higher volumes. I know, again, you can't speak to everything, but I hope that's not a trend in urgent care.
I don't think it's a trend in urgent care.
Good.
I've heard of some systems that, well, they just want you to see 60 patients a day with two team members. But I don't hear that very often.
Oh, good.
The urgent cares, I have a lot of friends in urgent care, and that's just not the case
Oh, good.
most of the time.
In your experience in the years you've been working urgent care, what kind of tests and labs and things do you have usually on site?
Urgent cares definitely should have x-ray capabilities. We have lots of point of care tests, COVID, flu, strep. We can do urinalysis, pregnancy tests, monospots. Some urgent cares will be able to do a CBC on site.
And so I assume that you're doing the initial read on the x-rays, and then are they overread?
They're usually overread within 20 minutes or 24 hours, just depends.
What kind of other support staff have you seen in urgent care that's kind of standard?
Most of our centers, if there's one solo provider, we will generally have 3 team members, MAs, radiological techs. If we have a center that has 2 providers, we like to have 4, maybe 5 team members to support the providers, support the volume. But most of our MAs are very good. They know how to do injections, they know how to draw blood, do splinting. So, yeah, most of that is a team member function.
And so when you have a PA or an NP working with a physician, is there any kind of division as far as what patients each person gets?
Whoever's ready to get the next patient, they'll just see the next patient. I can think back to my early days of urgent care. Back then, it was paper charting. They would kind of stack the chart on the counter, and if it was a real thick chart and I was ready to see a patient, I would look at them like, oh my God, what is that? Maybe I'd go back, get a snack, come back, and hopefully the physician that was working grabbed that chart. And I'm like, oh yeah, I'm good.
Yeah, you can't do that now.
Yeah, it's just whenever you're ready to see the next patient. If you're a newer provider, and you have a physician or another provider working with you, pick up that chest pain chart, go see the patient. You have somebody there that can help you out, and it's just going to make you better.
I guess that's probably my biggest nightmare is I get this scenario in my head that you're going to have a lot of people coming in who are, over 65, who are on like 20, 30 meds, have a very complicated history. And they're coming in with something that could be life threatening or
Right.
potentially very serious, but it could just be a mild exacerbation for them. I get in my head that that is a large part of the patients that you see. Tell me if I'm wrong.
No, you are spot on. I mean, we definitely see a lot of elderly patients who are on, 12 different medicines, and they have 6 allergies, and they come in for a simple UTI, but they're allergic to Bactrim and Macrobid and Cipro. And now you're kind of scrambling. Well, this antibiotic would work, but it may interact with their blood pressure medicine. I mean, it can be very challenging in cases like that, definitely.
Do you spend much time in urgent care consulting primary cares about patients that come in?
Definitely, especially on the patients that, again, are kind of on that border. Do they need to go to the emergency department? Can I call their primary care provider or their cardiologist? Or if I do an X-ray and there's something a little weird here, yeah, I will definitely call the radiologist. Hey, what do you think of this X-ray? So yeah, we still do a fair amount of consulting with specialists. Somebody who I think is pretty stable now, but they could get bad. We use Epic EMR, so I can send a message to their PCP or to their specialist and say, look, I saw this patient today, a little bit concerned about them. Maybe you definitely want to follow up with them pretty quick. And then they're always very responsive to that.
Yeah.
They'll send me a message back, thanks for letting me know. We'll get them on the schedule tomorrow.
What about like lab follow-up? Do you ever have people come in that you are sending labs out for any reason and have to, follow up with them later?
No, that's a great question. I'm glad you asked because the healthcare system I work for, we actually have two providers who do nothing but go through the in basket. So when that urine culture comes back or an STD blood work or culture comes back, they will take care of that for us.
Huh?
And that's great because, it's bad enough if you're seeing 35 patients a day and maybe doing a couple procedures throughout the day. And then you look at the in basket and you've got like 60 new results. It's just overwhelming there.
So we talked a little bit about some procedures that you do, but could you go through and kind of give people an idea of the most common procedures that you are going to have to know how to do in urgent care?
Of course, most common procedures are going to be your laceration repairs. We do a fair amount of INDs of abscesses. We do a lot of, ingrown toenail, partial toenail removals, and we'll do some foreign bodies in the eye. Some of our providers do joint injections, a knee injection, maybe a shoulder injection. And again, a lot of finger dislocations, a lot of nursemaids' elbows.
So what happens though when you get those things that are you're just unsure of if it's more complicated than it's looking at first, or you just feel like that they need a higher level of care? I feel like that may be a struggle with some people. Do people fight you on having to go to the ER? Do they refuse to go by ambulance a lot? What kind of struggles do you have there?
Yeah, that is definitely a concern in urgent care because most people when they come in with a complaint like that, when you ask them, you started having chest pain, it's going into your left shoulder. Why didn't you come to the urgent care? Well, I didn't want to wait in the emergency department. And then some people are just fearful that they know they're having a heart attack, but they seem to just not want to admit it. And hopefully you'll do something and tell them, you're fine, you'll be good. But it is a struggle. Pretty much all the time, we're going to send that patient to the emergency department. Definitely want to call EMS to transport the patient. Some will still, oh, I don't want to go, I can drive. And it's like, oh, you really shouldn't be driving. And so, if that's the case, then we can talk to a family member and then they can talk to the patient and get them, okay, I'll go to the emergency department by the ambulance. So it is a struggle.
What about the pressure to prescribe antibiotics? Is it as big of a struggle as I think with antibiotics when you work in urgent care?
I think it was a struggle 3 to 5 years ago, because I think that's when, at least in urgent care, we really started focusing on antibiotic stewardship. And I think COVID actually helped that, because when somebody came in with their upper respiratory infection and you swabbed them for COVID, they didn't have COVID, they'd be like, yeah, I don't have COVID, and they'd leave. I actually think COVID helped quite a bit with that. Now we're starting to get into steroid stewardship.
Yeah.
So we'll be focusing on that here.
So besides procedures, what's kind of like the bread and butter of urgent care that you're going to see day in and day out for conditions?
All the upper respiratory, sinus, you get your bronchitis. And, we're getting into the season where everybody's going to be outside working. So we'll start to see a lot of our orthopedic injuries, a lot of back pains, some bee stings, lacerations, poison ivy is going to be coming out.
Let's talk holidays in urgent care. I assume most of the time urgent cares are open every day of the year.
Most of them are, I believe. Some urgent cares will be closed certain days of the year. But in our healthcare system, we're open 365 days a year.
Let's talk a little bit about the schedule because we've been talking about 10 or 12-hour days. And again, this is something that's highly variable by urgent care centers. But what do you see as kind of the norm on schedules? Like how long are the shifts and usually how many days a week do people normally work in urgent care?
A lot of the urgent cares that I know, providers that work at, in a 2 week period, you generally work 6 to 7 days in that 2 week period. During the week, a lot of urgent cares are open 12 hours, so you're working a 12-hour shift. Weekends, some urgent cares are just 12 hours every day. Some have maybe 8 hours on the weekends. Our providers work every other weekend. So, like the first week, they would work Monday and Tuesday, be off Wednesday, Thursday, then they work Friday and Saturday. And then the next week, they work Sunday, off Monday, Tuesday, work Wednesday, Thursday, then they're off Friday, Saturday, Sunday. So you get a 3-day weekend every other week. With the exception of working a Friday, Saturday, and Sunday, you only work 2 days in a row during the week. So you have a couple days off to, do all that other stuff that you need to do during the week. It's a great schedule. The one other thing I really did hit on with urgent care is once you are done for the day, you're done. You don't have to go home and do any charting or go through the in basket like in maybe family practice. Once you leave there, you're done.
Another thing I've seen in forums is that it just seems to really run the gamut of how people are treated in urgent care. I've seen some people talk about that they're expected to just see a ton of patients and there's no cutoff time. So sometimes they may be there for hours after they're supposed to be off. Sometimes I've seen the opposite. I've seen people say that sometimes that they get sent home if there's not enough volume, and then but they still have to be available to come back in if the volume picks up. Have you seen things like that happening in urgent care?
The worst thing about urgent care, it's exactly what we're going to talk about now. Yeah, if you're open from 8 in the morning till 8 at night, yeah, I mean, generally you're expected to see somebody, even if they show up at 7:58 at night. I struggled with that early on. I really did because I mean, we were busy, but I've learned to accept it. I think last year I learned to accept it. It only took me 24 years, but and especially if, the first half of the shift, maybe you see 15 people, and then the last 3 hours of the shift, 15 people show up. It can be frustrating, but for me, all it really takes now is one of those patients to say, "Hey, I know you've had a hard day. Thanks for seeing me this late at night." And that makes it worth it.
I assume the ones that they talk about that are sent home must be in an urgent care that has like two providers on staff. Have you ever heard of things like that happening? Is that a common practice that you're aware of?
I don't think it's very common, but I have seen it happen even with us. We try not to send providers home because as soon as you send somebody home, 12 patients show up
Yeah.
at the center, and it just makes for a better day. I mean, some of the healthcare administrators may not want to hear me say that, but if you have two providers at a clinic all day and they see 35 patients, yeah, it's not great for the bottom line, but fantastic day for both providers. And they probably deserved it because there's many days, again, you're seeing 35, 40 patients by yourself and you're exhausted. So,
But
right.
speaking of like being sent home, so the problem with that is I assume most people in urgent care get paid hourly, or am I wrong? Is it mostly salary? Are there RVUs that come into play? Again, in general, what are you seeing
Yeah.
out there?
In general, it's pretty variable. I think nowadays a lot of urgent cares pay their full-time providers mostly for that shift. Okay. It wouldn't be like hourly. You'll get paid for that shift. Like some of our per diem providers or part-time providers, they're usually paid hourly. But most places that I've talked to, you get paid for the shift. It's almost like a salary, but if you work extra, somebody calls off and they call you, "Hey, can you go help out with this clinic today?" Yeah, you would still get paid for that shift.
Money should never be why somebody goes into a specialty, but it certainly plays a part in decisions. So, can you give us kind of an idea of what people could expect for salary in urgent care?
I think for as long as I've been in urgent care, it's usually paid above the average. I think it sits somewhere in between emergency medicine providers and family practice. New grad is probably anywhere from 120 to 125, somewhere in there. So it's very good pay.
Do you see it generally pretty equally split in your organization between NPs and PAs in urgent care, or do you guys skew one way or the other?
We're fairly split between NPs and PAs. And that you mentioned that too, some of our per diem providers, we have one per diem provider who works in dermatology. And I love working with her because when I see that rash, I'm like, she'll say, "Oh, it's this. Didn't you know that?" So it's great because we have a lot of specialty PAs and NPs who work per diem for us, and they're tremendous resources to have.
Well, so that was leading me to my question is if somebody was working as a PA or an NP already, and they were thinking about getting into urgent care. What do you think are some of the best specialties that transition over, or does it even matter? Do you feel like they're all pretty equal to transition over?
Well, definitely emergency medicine, PAs and NPs, when they've just had enough of the emergency department, they'll come to urgent care. So they're great. And we've had some cardiology PAs come and work for us. I think doesn't matter the specialty or if whatever they were in before. Most of them do very well transitioning into urgent care. There may be a few shifts that we kind of work with them and, make sure procedural stuff is pretty good, reading EKGs, reading radiographs. But yeah, I think it's a fairly easy transition for most PAs and nurse practitioners.
Yeah, it made me curious when you said when they get tired of the ED. What do you think is the advantage or the appeal to urgent care over emergency department?
I think it's a little bit more laid back, obviously, than the emergency department. I worked yesterday with a physician, and we had about an hour and a half where we didn't see a patient. And it was great because, you get to talk to the other provider and you get to talk to the team members. And it's just great to have a little bit of downtime. I think emergency department is just it's just a constant chaos. And urgent care it's chaotic, but not as much as the emergency department. And there's times where it's just more chill, more relaxing, and just better mentally.
Somebody is looking to go into urgent care and they're interviewing with places, what are like the top questions that you would ask to kind of make sure you're not walking into a nightmare type situation?
If there's a healthcare system that has 8 positions open, my first question is, why do you have so many positions available? Are you opening new centers, or did you make those providers see 60 patients a day and they just quit? You can definitely ask about volume. What is the expectation to see how many patients per day? What is my support team member staffing like? Do I have one other person? Do I have three? Those are probably three of your most important questions.
Tell us in general the things that you have come to really love about working in urgent care and what you think would appeal to people most to work in this specialty.
Again, I like the variety in the patients. I think it's a great for new graduates because when you have a new grad that comes in, they're going to do procedures. They're going to see a lot of ortho. They're going to see a lot of dermatology. You're going to get your chest pain, your cardiology patients, your abdominal pains, your gastrointestinal patients. I mean, you're going to see a lot of different specialties. And then what I've seen happen frequent is this provider, came in, they've been here 2 years, and they love seeing orthopedics. And then they go specialize in orthopedics. But again, it's a great first job, I think, because you get to see a variety of everything. Urgent care is great. And it's a great schedule. Again, it's dynamic, it's energetic, and it's rewarding.
Great. Well, thank you so much for letting me pick your brain and learning more about urgent care.
Well, I appreciate you having me on. Thank you.
If you've liked learning about urgent care and wonder what it's like working in other specialties, then click on this playlist here and it'll take you to a bunch of interviews I have with PAs and NPs working in all different areas of medicine. Thank you so much for joining me today. And as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.